Broadcasting from the business capital of the world, this is the Podcast Business News Network.
Excited to have back with us Peggy Smith joining us here. She's a hypnotherapist and registered nurse at Happy Possibilities LLC. That's Happy Possibilities hypnosis business site. We're going to reach out to her there and we're going to say hello to at Happy Possibilities again. How you doing today, Peggy?
Hi, Jill. I'm fine. Hope you had a nice weekend.
Thank you. I did. And yourself?
I was working, but it was good.
Good.
It's always good to be able to work.
Well, please introduce yourself to our listeners and viewers today.
Okay, I'm Peggy Smith. I'm the owner of Happy Possibilities, LLC. I've been a nurse for, I guess, since 1985 and been practicing hypnosis since 2008. Because my business is Happy Possibilities, I've given this podcast series the title of Healthy Possibilities, You Have Choices. So today, because we're still in the month of May, I'm going to address Mental Health Awareness Month and how hypnosis can and possibly cannot help with mental health issues.
Okay.
I think that would be appropriate for this.
Absolutely. And is there a phone number you want us to share before we?
Yes, my phone number is 1-267-593-5557. And I also want to put out there, since we're addressing the mental health issues, the suicide hotline, if anybody needs some help, is 988, or call 911 and go to your nearest emergency room if you're having a crisis.
Got it. Thank you so much. All right, let's begin, Peggy.
So, well, when I started hypnosis, my intention was to offer my cancer patients, because that was my specialty, some alternatives for pain management, so that they would have a better quality of life and not feel drugged up all the time and too weak and sick, to move. And traditional methods of managing pain with medication often has side effects and, tolerance issues. So I became really interested in complementary alternative medicine, which encompasses a whole bunch of different modalities. From acupuncture, Reiki, hypnosis, some of the energy choices, exercise even is a modality. And I help people create healthy lifestyles so that they can improve the quality of their life. So in addition to, because of the current opioid crisis, it's actually very hard for people to get a lot of the medications that they were used to having. And a lot of them feel kind of abandoned by the medical system. So I try to advocate for being proactive in your healthcare and looking for options that would work for you. And there's no magic wand. Hypnosis is not going to say abracadabra and now you're a new person, or you're a skinny person, or you don't have any more pain. But when a person is working with the practitioner, they feel less helpless because they've got some say in what's going on with their life. Mm-hmm. So with the first of the series being dedicated to mental health awareness, I wanted to dedicate this first podcast to a young man that I met on Facebook named Jason just a couple weeks ago. Jason, like many people, most of us, in fact, live with sometimes complicated and overwhelming issues related to his mental illness. He lives in kind of a rural area, so he doesn't always have access to the options that somebody in Philadelphia or New York would have. But he went on Facebook and just wanted to tell people with mental health awareness that it doesn't mean you're weak, it doesn't mean you're crazy, but there's help out there and you can get better. And he wanted to encourage people, and that just made me, consider making my first podcast this series, with mental health. Mm-hmm. The general definition, a generic definition of hypnosis, is just an enhanced state of relaxation that helps create a very focused state of concentration. You are able to be fully cognizant of what's going on, although you might feel like you've had a little nap when you wake up, even if it's been 5 minutes. But while you're very relaxed like that, you don't have the distractions of your everyday life, and your mind is able to consider other ways of looking at problems that may have been overwhelming. I don't like the word problems, we'll call it challenges. Mm-hmm. And you do it in a very safe place because you're in control, but you don't have all the things that usually distract you. And I help create safe places so people can consider other options for their life when their life is not working so well.
Yeah.
The client never gives up control in the state of relaxation. A lot of people are afraid of that. And there's no hypnotherapist that will ever convince you to do something that you wouldn't do that would go against your morals or ethics or anything. You have full control of your behavior. You have full control. And, if you hear something that totally goes against your brain and your upbringing, your mind will not accept those thoughts. And that's important for people to realize. I'm not a licensed mental health professional. As a registered nurse, I operate my hypnosis and my nursing practice within the scope of my nursing practice. That does supersede everything else I do. But with that said, I have the advantage of when a client comes to me, I can look at the entire picture. I can look at medications they're on for any number of physical or mental problems and identify side effects they might be having, explain to them maybe a different way of taking the medicine to minimize the side effects, give them questions to talk to their doctor about. So it's really been a blessing that I'm able to enhance my nursing profession to help people in this way. There's a lot of concerns and factors that contribute to mental health issues. Some of them are physiological based. And that means that the brain kind of short circuits sometimes, and the areas of the brain that affect intense feelings, impulse control, kind of the filter. There seems to be a lot of that. We'll stay off of politics, but anyway. The things in your brain that create internal and external chaos. And a lot of people are resistant to medications. Obviously, I work in traditional healthcare. I'm not going to tell someone not to take something that's prescribed, but I can explain it in a way that they don't feel so resistant. If they understand that the doctor's not trying to make them a zombie and control their life, and why the drug can or cannot help. And doctors aren't perfect. Sometimes it takes one or two tries or different time of the day taking something to get it to work. But I try to encourage people to be open-minded and collaborative with their doctors. Yeah. It does make the final road to getting healthy a lot easier. Hypnosis can help mental health problems by teaching stress management, anxiety reduction techniques, anger management. A lot of times, intense depression is really repressed anger. And until you're involved in maybe a talking therapy situation, you don't realize that. And you're just angry at the world. And turns out you're really angry with yourself, but projecting it on the rest of the world. So with hypnosis, I in a very gentle, safe way, I encourage them when they feel ready to look at the whole picture. And they come up with some of the suggestions themselves of what they want to improve their life. Quality of life can get better. A person doesn't have to be imprisoned in their mind. And many people that have not had adequate medical care don't understand how much it can make your life easier. But it does help if the client has an internal desire to get better, to get healthy, and the motivation to do the work that it does take. I often compare mental illness to diabetes or some other chronic illness. When you have a mental illness, you have certain responsibilities to yourself and your family, and as far as taking care of yourself so that you're not a burden on them and they have more things to worry about. You follow your diet, take your insulin or your other diabetic meds, do exercise, you'll be healthier. And mental illness is no different. If you need during the rough patches, take medication to get to your therapy appointments, that's all your responsibility. It's actually nobody else's. And I try to empower people to realize that it's okay to be responsible for yourself. It's actually a good thing. Yeah. I do virtual sessions, and we go over a lot of different, we usually, the first session I'm doing a regular medical history, finding out what they think their problems are and what they would like to work on. You can't work on everything in one session. You might have this fantasy idea of what healthy is, no smoking and no sugar and all these things. But if you create more stress before you eliminate some of the stress, you're not going to be successful. Yeah. So that's really how hypnosis can play an important role in managing mental health issues. Um, Sometimes I get phone calls from people who have court-ordered therapy. They want to know if they can come talk to me, and I'll sign off on it for the judge. And no, I won't do that. Somebody has addiction issues or dual diagnosis. Um, Hypnosis can help with some of the cravings and the parts of the brain, impulse control. But I strongly recommend somebody be in a 12-step program and have, like, I don't want the responsibility of having all this support. They need professionals that are working this every day. And most people don't object to that. If they're already in therapy with a professional, I actually will not start anything with them unless I have the permission of their practitioner. And then I kind of work it like I would a home care patient. We work collaboratively so that I'm not undoing what the doctor's doing and making his job worse. And I think it's pretty positive, especially with insurance situations, and a lot of insurances don't cover this much needed service. Hypnosis is a lot less expensive. When somebody is in a session, I create an individualized recording that they take home and they practice, because that's how you get good at it. That's how you feel more confident, and you can actually see the changes taking place. You feel them first, I guess, and then you see them. And I strongly encourage people to keep a journal, because no matter how bad you think your life is, chances are, if you've been keeping a journal, you'll realize on a terrible day in the present, look back and say, gosh, today's nothing compared to 2 months ago. And I got through it. So, we're going to get through today too. And that's basically how I address, the mental health issues. If anybody has any personal questions that they would like to email or text me or call me, I'm happy to take that. And I know it was suggested, Jill, that maybe we could consider having a call-in at some point for people during these podcasts.
That'd be great. Mm-hmm.
And I'd be happy to take questions, that way. And I don't know, Jill, do you have any questions or thoughts that may have come up while I was talking?
Well, let me ask you this. I mean, with what you do as a hypnotherapist, and you're like in both realms in a sense, like Eastern, Western medicine, which
Right.
makes it awesome because there's usually one or the other, and it's great to know that you're, can I say holistic? Because it's like you're all in one. So you could see the benefits of both, because some people in the medical field look, against it's like Eastern, Western philosophies, but the fact that you do both to me makes you very unique, but I think you could see more out of that with your job as being a registered nurse all these years, and let alone the hypnotherapy. You're open to all these possibilities of other realms of medicine besides just straight form of medicine. Here's a prescription, fix that, do that, right? Because in medicine, let me see, I'm sure you've worked with plenty of doctors who prescribe certain medications for things, and not every medication works, right? But then you come to hypnotherapy, and I heard there's like, okay, maybe I'm wrong. Is it over like 300 and something things it could help with, or it's more than that?
Oh, it's more than that. It can help with almost any situation.
Wow.
I was a special ed and another teacher in another lifetime, and I frequently get special needs clients.
Ah,
I've had parents of people with Down syndrome, now that they're adults, say, can you help teach them healthy habits to eat? I don't want them to gain weight. And then I kind of have like a family hypnosis session where everybody does teamwork and makes the menu plans together. And, the actual client doesn't even realize he's a client. He's all excited that he's going to make his parents healthy. And gosh, he might get healthy in his home too, but then they'll go to restaurants with their peers from school and the workshops and stuff. And then they'll coach their friends. Oh no, that's not healthy to eat. You need to make a different choice. And that's kind of rewarding for me to see. Because that's any population can benefit from hypnosis. I've worked with children with Tourette's. I've
mm-hmm.
worked with ADHD. I've many children on the spectrum, and this with that kind of we work on their level as maybe working on reducing the anxiety, the stimulation, things like that, and building trust for some of the children that have trust issues. But a lot of the adults have trust issues. And everybody comes to me to come to any doctor with a different background, and I'm really a strong patient advocate. I want to see more patients just not rely on the doctors. The doctors can't read your mind. They're frustrated too when they can't help you or when you're not talking to them to explain. They have to guess. Well, their eyebrow is wrinkled. You must have a headache or something. You've got to communicate, and hypnosis, if nothing else, can help you relax enough to trust your doctors to talk to them about what's going on.
Interesting.
The next podcast will be about chronic and acute pain management. And I also help people when they have impending surgery and a lot of anxiety about that. We kind of go through the process in their mind before they get to the hospital for their knee replacement or whatever. And, it's just going to be like, oh, wait, I've been here before, I can do this. And it's been very rewarding for me to add this to my, more rewarding, I have to say, than nursing is these days. Healthcare is very frustrating for nurses these days.
Oh, I can only imagine. And all y'all went through during the pandemic. And how many people do you know that have worked in the medical field are like still burnt out from that and have changed careers because of the overwhelm?
Many
I
have
can only
changed
imagine.
careers. I had reached a point when I first went into hypnosis where I was burnt out from years of critical care. And I became a bumper T carrying clown in the Philadelphia area, Patch Adams clown, hospital clown. And that was so cool because it actually reignited my joy of helping people, because I was so bogged down with the paperwork and the supplies not being available, and doctors angry too because they can't do what they want. Everybody's frustrated and taking it out on everybody. And it's a lot of fun to be a clown. I still do that.
Oh my goodness, that is beautiful. I can see the light in people's eyes, especially the children, even the adults, though, right?
No,
Let's be honest.
actually, believe it or not,
Is it the
I do not see children. I'm very disappointed that I can't. Children, a large number of children are afraid of clowns.
Oh gosh.
And I was so disappointed to find out when I went to high school in Atlanta, and I wanted to there was a clown college in Florida. My parents, of course, would not pay the money for that. And apparently nobody else's parents did either because it went out of business. But so when I had the opportunity to be a hospital clown, it was like, my childhood fantasy,
Dream
be a
come
clown.
true. Oh my goodness.
And this is so much more fun. I mean, I don't have any sense of balance. I could never ride a unicycle or anything, but I've been in situations as a clown where maybe the IV comes out and the patient's bleeding, and I have to go find a nurse who's on lunch break to fix the problem. I'm not even allowed to put a towel over
or anything
because I'm not there as a capacity of a nurse. So I have a little specimen cup with a wooden stool inside it, and I say, here, doctor wants a stool sample, just give him this, and I have a lot of fun with it.
Oh my goodness, I could only imagine. Wow, you're a multi-talented. Look at you, Peggy Smith. Just to remind everyone again, Happy Possibilities, your website.
My website, I actually have a couple. The one you mentioned was the Google site.
Okay.
And the other title is a little bit simpler. It's notjusthypnosis.biz.
Oh, that's better. Definitely.
That's much
Not
easier.
Just
Hypnosis. They both have the same information.
Perfect. Oh my goodness. And I know we talked last time about drug addiction, right? Hypnotherapy helps with that. You also work with those addicted to opioids, right? That can be helpful. We know smoking, weight loss. I mean, what else did you want to discuss for today?
Well, sometimes people with mental health issues are so distrusting, especially if it's a physiological, like a schizophrenic or, something like that. And I'm able to, with just patient relaxation and relieving their anxiety, getting them to consider, because their mind is fine. It's just a little jumbled sometimes.
Yeah.
And, so it's very rewarding to help them. It's okay to trust the doctor. He's going to make it better, and if he doesn't, it'll still be a little better than you are right now. And, I do a lot of education, not just hypnosis, but I try to see a lot of times, at least I've learned in nursing, whatever the patient comes to you is not really what's wrong. I learned that from the ER, I've got a sore throat. But then you find out that, they're bleeding rectally and all this other stuff. They didn't want to tell anybody. And so, I guess I've got the fortunate skills of being able to talk to people and see between the lines. And that helps me with the hypnosis. I don't use canned hypnosis scripts. I find out what I'm dealing with, and then I create something, whether it's, I do a lot of grief hypnosis, the loss of child, loss of parent, loss of animals, because that's just natural offshoot of my hospice work. And, there's people that I can teach someone. I don't personally like dentists, and I've never practiced these techniques on myself. This is one that I don't do. But I've been able to help people get dental work with no anesthesia.
Wow. I have my nephew who's special needs who can't go to the dentist. He's 15, and they knocked him out twice at the hospital to pull teeth when he was younger. But now like his teeth are crooked. He needs this, but they're like, what are they going to do? I never thought about that. Hypnosis.
Hypnosis can actually help, as long as, because I don't, with children, I don't wear my white lab coat. I kind of come down to their level. I have toys in my office too, besides, and stimulating type things, fidget things and fidget cubes and all those things, so I reach them on their level. They trust me. And then, I get them to tell me why they're scared. And, we're able to work through that, maybe a little bit slower than I would with a person. An adult, person. But there's just so much that, and mental illness and mental challenges permeate just about every area of health and every area, and they're so misunderstood. You just have to take time to listen to them. I've had people afflicted with cerebral palsy, and the ER doctor telling me that they're intoxicated. And, I was a special ed teacher. I work for this population. No, doc, they're not. We don't need a drug screen. We need to find out why he's having a seizure right now,
Yeah.
So you have to educate the doctors too sometimes.
Interesting.
And, but I've always had the approach that, you might have more names after your title, but that just means you've got a bigger loan balance in your schools. And, you're too busy trying to get.
Who's a nurse, another one's a nurse practitioner, and they tell me all the stories all the time, how they know more than the doctors. And I'm like, wow, isn't that amazing? But the doctors think they know it all. I'm just saying some, not all. This is a disclaimer, but yeah.
That's true, but and I don't share my personal feelings with a lot on some really things that I've seen. But healthcare, I don't see it getting better. It's costing more money. It's the option. There's necessary chemotherapies that aren't available right now, and there's no options for them. So it's very sad. It's very frustrating. And I think if we had more doctors maybe making the rules and running the insurance companies, maybe we'd get better results.
Maybe then you'd get exactly.
Yeah.
Interesting.
But there's a lot, and I'm very strongly advocating, please talk to somebody if you're having some issues. It doesn't mean that you're hopeless, you're weak, or anything else. And you have options out there. I personally take advantage of acupuncture twice a week. It's very relaxing. I just down the hall was a massage therapist today, and I said, "Oh, I've got to make you an appointment," and just even massages or self-care, and that's an alternative medicine technique.
Yeah.
So,
well, Peggy, we have to wrap up. Unfortunately, we're just about out of time. How did you want to end today's show? Anything you want to add?
No, I just want to thank everybody for listening. And, if you have topics you'd like me to, questions about, feel free to email me. I'm happy to answer them. Like I said, next week we will deal with the pain, acute and chronic pain, and that's quite a big topic by itself. When we do weight loss, I'm going to be doing traditional weight loss for hypnosis, and then I have a separate show on bariatric hypnosis, where we kind of go through the surgery without any surgery. And I'm an integrative health nutrition coach, actually from New York. So when I do weight loss hypnosis, I also do health coaching and diet teaching, and
so much to you, Peggy Smith. We got to talk more about that next time too.
So, all right. Well, it was great talking to you and seeing you again.
You too. Thank you again. Pleasure.
I'll see you next Tuesday.
Are you looking for even more of the podcasts and hosts that you love? The Podcast Business News Network is proud to announce that you now have even more ways to listen live. Check out the MyTuner Radio, online radio box, and Simple Radio apps on iOS and Android, or find us online. Search for Business News Network on mytuner-radio.com, or search Podcast Business News Network on streama.com and onlineradiobox.com/US. Take your podcast on the go and don't miss a minute of the action.
Broadcasting from the business capital of the world, this is the Podcast Business News Network.
For nearly 2,000 severely injured veterans, everyday life has become filled with barriers.
Day-to-day simple tasks can become pretty daunting.
I have to carry my chair up 2 flights of steps or have somebody do it for me.
What scares me the most is just the falling.
When I'm struggling with my house, I think, to have that one great barrier just knocked down, it's crucial.
Home for Our Troops is a wonderful nonprofit that builds a
Mortgage-free, fully adaptive, handicap-accessible house. And there's no catch.
It'll be our very first home that we've ever owned. This is a game changer.
This is where your life begins again.
We need you to join us in completing this important mission. Please visit hfotusa.org and help build homes and rebuild lives.
Because of you, everything's going to be okay.